We are litigators here, but I would like to discuss with you today some ways that you can hopefully avoid becoming a malpractice victim. One of the first things that you can do is look your doctor up. With the advent of the internet, here in California at least, you can go into the medical board website, type in the doctor's name, and get information about this healthcare provider, and you can learn a lot of very useful information. In a recent case that I just concluded, the doctor in question had misidentified the common bile duct and clipped it and cut it and caused this patient to suffer a very severe life-threatening injury. Well, if the patient had taken the time to look the good doctor up on the internet, would have found out that this doctor had been disciplined in the past and in fact had an ongoing investigation, and he was questionable. So take the time, look your doctor up. It's easy to do, and if the doctor in question does have some baggage, you can avoid becoming his next victim. Another thing that you can do, again with the advent of the internet, is you can look up your medical condition. You're never going to get as much information or get the knowledge of the doctor that's taking care of you, but in that limited area, your condition, you can become extremely knowledgeable. In fact, have the same knowledge or more knowledge than the doctor that's taking care of you. That's very important in this day and age. In a recent case that we concluded, in fact, it went to a verdict. The patient was having chest pain while laying in bed, severe chest pain. It caused him to go to the doctor, and the doctor put him on an EKG machine and told the patient he was just fine. The EKG was normal. Well, if the patient had taken the time to look his condition up on the internet, just type in chest pain, new onset, severe, he would have found out that this is a life-threatening medical emergency. It's called unstable angina. He would have probably also found out that EKG machines are notoriously inaccurate, especially in an office setting. He didn't do that, of course. And as a result, he died. He, in fact, was having a heart attack when he was having that chest pain. It went undiagnosed, and he died. Left behind a widow and two wonderful children, but he missed that opportunity. And lastly, something that you can do that's very helpful is get a second opinion. You may love your doctor, think he or she is the best doctor in the world, but if it's a serious matter, get the advice of another doctor. You may find out some very useful information. In another case that we had just concluded, a lady had undergone reconstructive surgery after undergoing a mastectomy and radiation therapy for cancer. And she was looking to get her figure back. And the operation in question was called a tissue flap transfer procedure. Very complicated operation, fraught with risk. That operation turned out to be a failure for her. So not only did she undergo the ravages of cancer and the treatment, she had lost her opportunity to have a reconstructed breast. If she had gotten that second opinion, she would have found out that the doctor that she had selected to do the surgery was using an old, outdated technique, and it was almost doomed to fail. If she had gotten that second opinion, the odds are very good that she would have found out that the doctor she selected was way behind the learning curve and out of date. So the long and short of it is, it's not foolproof, but there are things that you can do to be proactive and avoid becoming a malpractice victim.